Come in.
Hello, sir. My name is Kier. I'm a nursing student here with Advent Health University. I'm here to do your assessment on your eyes, ears, nose, mouth, and throat. Is that okay with you?
Yes.
Before we begin, this should only take a few moments of your time. Would you like a glass of water to use the restroom?
Oh, thanks.
Okay, just give me a few moments and I'll be right back.
Okay.
I'm going to close the curtains for patient privacy. Wash my hands for 20 seconds. 20 seconds has been fully stimulated. And sir, can you state your first and last name and date of birth for me, please?
Yeah, it's JD 1996.
Perfect. So patient stated first and last name does match with the hospital band. So let's go ahead and begin with the assessment of your eyes, okay? Do you have a history of cataracts, glaucoma, or anything of that nature? No. Okay, so let me take a look here. So patient's eyelids, eyebrows, and eyelashes are all appropriate. There's no erythema, there's no ptosis, there's no edema, and there's no dry skin. And the eyes are symmetrical to each other and the remainder of the facial features as well. And let me get my gloves. Okay, so there's no crusting noted. The conjunctiva is pink in color and there's no obstruction in the lacrimal duct. The lens is clear, the sclera is white, and the cornea is transparent with small underlying blood vessels. The pupil color is actually brown, and then we're going to take an estimation of the size of your pupil, okay? Perfect, so an estimated pupil size is about 4 millimeters. And then so we're going to go ahead and begin with the light reflection, okay? So just look ahead regular. Perfect, so the light reflection position is the same in both eyes bilaterally. And then let's go ahead and you're just going to follow my pen, okay? Perfect, so patient's gaze accommodates accordingly to movement. And then what I need you to do is look all the way in that corner where that blue camera is. And so when this light comes into your eye, into your field of view, I need you to look directly at it, okay?
Okay.
Perfect, so patient's eyes accommodate accordingly to light. And then lastly, let me just take a look here. Perfect. So patients' pupils are round, equal, reactive to light, and accommodate accordingly with consensual response as well. All right. So let's go ahead and move on to the assessment of your ears now, okay? Have you had any previous ear procedures completed, or have you had the use of hearing aids ever in the past?
No.
Okay, so just look straight ahead for me with your head aligned. Okay, so ears are aligned and equal to each other and the remainder of facial features. The external meatus is intact, there's no drainage noted, and there's no skin discolorations or lesions observed either. So let me go ahead and just take a look here. Perfect, so there's no skin breakdown, the cartilage is intact, and there's no palpable deformities felt either. So what I'm going to do is perform a whisper test. So I need you to cover your ear. I'm going to repeat a sequence of letters and words and then just repeat it back to me.
Okay. A-L-H-U.
Perfect. And let's repeat it on the other side.
M-O-P-S.
Perfect. So patients capable of repeating the sequence without any errors. And then let's go ahead and move on to your nose. Do you have any reoccurring sinus infections or any nasal procedures completed in the past?
No.
Okay, so overall patient's nose is midline with the rest of the face. There's no noted skin discolorations and there's no lesions seen on the top of the skin. And let's go ahead and you're going to cover one nostril and sniff in and cover the other side. How does that feel?
I'm a little congested on the right side.
Okay, so there was some obstruction noted on the right side and overheard, and patient reports some congestion on the right side as well. Septum is midline, nasal mucosa is pink, and there's no noted crusting or mucus noted. There's no small blood vessels observed either. Alrighty, Mr. JD. So lastly, we're going to do an assessment on your mouth and throat. Do you have any history of issues with tasting of food?
No.
Do you have any reoccurring throat pain or issues with swallowing?
No.
Okay, so just open your mouth for me. So all teeth and molars are present and white in color. The hard palate, soft palate, and the buccal mucosa are pink in color with no noted swelling or inflammation. The top of the tongue is noted of a pink color with some white variations throughout, but overall small little bumps which are noted as the taste buds. And lift your tongue for me, please. The ventral side of the tongue is smooth in appearance, pink in color as well, with small underlying veins and blood vessels. Let me just take a look at your gums. The gums are pink in color as well, but there's no noted inflammation. And lastly, open and say ah.
Ah.
Perfect. So uvula rises symmetrically with ah, and cranial nerves 9 and 10 are intact. Okay, Mr. JD, now that I was able to complete your assessment on your eyes, ears, nose, mouth, and throat, is there anything else I can help you with?
No, thanks.
Okay, well, here's your call bell. If you need anything, please feel free to press it. Either myself or the other attending nurse will be in, but I'll be seeing you in approximately an hour, okay?
Thank you.
You're welcome.